Hi everyone, Dr. Tim Whiting of Stirpe Chiropractic and Wellness Center. Thanks for tuning in for another episode. We haven't done one in a little while, so I'm kind of do like a 2-for-1 today. We're going to be talking about mostly the glute musculature. So think about your glute max, the big muscle here, as well as some of the surrounding ones in this area, your glute med, min, a little bit of the smaller muscles, and how they tie into lower back pain, SI joint pain, which is basically right in this area, as well as some knee pain, which you'll notice with a lot of runners, which we'll call your IT band insertion or IT band issues. So with any of those things, anytime I have patients coming in that are complaining of lower back pain, SI joint pain, or maybe some lateral knee pain, first thing I'm going to do is I'm going to look at these muscles, see if they're weak, see if they're tender or hypertonic, and then progress onto that. So a lot of these muscles are going to attach right here. This is your pelvis and your sacrum. So we're looking in this area. So you got your big muscles that lie over here, and they actually control the leg in a bunch of different motions, including extension of the leg, driving that leg backwards, as well as stability coming out or coming in. And that's what we see a lot of the problems with, that we have weakness on the muscles that abduct or bring the leg out this way, and that puts excess strain on the big muscles, the glute max, as well as straining the IT band as it comes down and inserts here. And that's why a lot of people end up with pain alongside of the knee, because that muscle is just too tight from not having support from the glute med and min. So those are just the things I'm going to show you today. One, we're always going to incorporate some kind of chiropractic manipulation. So for this previous videos that we've used, you'll see when Dan was laying on his side, we kind of did an adjustment of the lower back and pelvis. That would be something we would address, making sure that pelvic alignment is where it's supposed to be so those muscles can work and move freely. Next would be some soft tissue work. We'd be having the patient lie down, really digging into the muscles along the sides of the hip, as well as coming down the leg on them to make sure there's any knots, trigger points in there that we can remove. And then the last component, which I think is the most important, is going to be the strengthening component of it, in which we're going to use either rock tape, which we've used in the past, which we would tape right down along the whole IT band, as well as a strip over the glutes, or using some sort of band, some sort of resistance, like we have TheraBand in the office. And I'm going to show you some exercises right now to really work on the functioning and the firing of these glutes. So the first one's going to be simple. All these can be done at home. We don't need to go to the gym and use expensive machines. It's literally going to be a table or a mat at your house and a band. And that's what I like to do. I try to make it as simple as possible for the patients. So first one is going to be focusing on the glute max, so the big muscles. It's just called a glute bridge. So you're going to lie down flat on the floor, table, whatever you have. Feet a little bit away from your butt, hands down by your side, and you're literally going to bridge up. They call it a back bridge or a glute bridge. And you're just going to come up into this position, focusing on firing your butt and not your lower back. What I see a lot is the low back fires first, and you can simply hold there and make sure that those muscles aren't firing. So we're going to drive your heels into the floor as we squeeze your butt to really get those hips up into the air. You're going to hold that for a few seconds, come back down, and we're going to repeat that as an exercise. Eventually you can progress to driving up and then doing one leg off for more balance. You're going to switch that and hold as we can get into more fire. So that's going to be the first one I'm going to want you to do to really work on the fire in those big muscles. Next, we're going to lay on your side, shoulders stacked up, legs stacked up like this, and it's simply going to be raising the leg straight up. You're going to feel that working these muscles up in here. If you're feeling it someplace else, chances are you're twisting your leg, either toeing up, which is going to put that on the quad, or possibly coming this way, which is going to put that more on the hamstring and the glute max. We should really feel it right here in the hip. And we're just going to do that as a set, again, like this. Bring this up, doing it for sets of 10, maybe 15. Next one, same position, except we're going to bend the knees. And so we're going to be kind of having this 90-degree angle in the knees. That's what we call a clamshell. We're going to open up the legs like this. Again, you should feel that back here, maybe a little bit down into here as well. And you're going to do those for a few. And that's really working on these firing patterns of the glute med and min, which are often weak and causing the instability at the knee or the pain in the pelvis and the joint. All of these can be progressed by using a band in some fashion. Here for this one, we'd be wrapping a band around here, adding that resistance, so that way now we have to come up against resistance. Same thing, if we were doing this one here, we put it around the feet and have that as resistance that way. Or if we were doing the bridge this way, we'd still put it here, but now we're trying to press that out as we're bridging it up. And that kind of does a 2-for-1, where it fires the outside ones, those glute med and min, while you're driving up your butt into the glute max there. So those are things that I would send you guys home with. You'll be doing them daily for the first little while and progressing on with those. But very common with SI joint pain and IT band stuff. So that's going to be it for today. If you would like to get in the office and we can kind of evaluate you and see if this is something you might benefit from, please stop by or give us a call, 315-472-7128. Thanks for tuning in.